Good day! My name is Princess Julia E. De La Paz, a student nurse from Nueva Ecija University of Science and Technology. And today, I will be performing the Leopold's maneuver, the auscultation of fetal heart rate, the measuring of fundic height, and the perineal care. Obtain the obstetrical history of the client to confer a woman's suspicion of pregnancy. Number 2, prepare the equipment and supplies, which is stethoscope, tape measure, and bath towel. The rationale of this is to save time and effort. Verify the physician's order. Prior to performing the procedure, introduce yourself, verify the client, explain what you are going to do, and why is it necessary. Good day! My name is Princess Julia E. De La Paz, a student nurse from Nueva Ecija University of Science and Technology. May I know what is your name, please?
Princess Alexandra Baby Lagarta.
Where are you from?
Nova Ecija.
And what should I call you?
And
Okay, so I will call you Ma'am Princess. Is that okay with you? Ask the client to empty her bladder before performing the procedure. Nakaihi ba kayo bago natin simulan ng ating procedure?
Opo.
Position the client in a dorsal recumbent position, then place pillow under the head for comfort. Place a small pillow under client's right hip and ask the client to be still with arms on side. So ma'am, I will place you to the dorsal recumbent position, but first, I will place pillow under your head to provide comfort. I will place you now to the dorsal recumbent position. I will also place a small pillow under your right hip to provide comfort. And your hands still on the side. Drape the client with a draw sheet exposed from below the breast to the symphysis pubis. Perform hand hygiene and observe appropriate controlled procedures. Close the curtains of the bed to provide privacy. Provide client's privacy. Observe the woman's abdomen for longest diameter when fetal movement is apparent. The rationale of this is the location of activity most likely reflects the position of feet. For the first maneuver or fundal grip, stand at the foot of the client. Facing her, place both hands flat on her abdomen and palpate the superior surface of fundus. The rationale of this is to determine the fetal presentation. Head is round and hard, the breech is less well defined. So I will be now performing the first maneuver. Soft and small. The second maneuver is the umbilical grip. Face the client and place the palms of each hand on either side of abdomen. Palpate the site of uterus. The rationale of this is to identify the location of the fetal back and to determine the position, which is anterior, posterior, cephalic, or oblique. Now I will be performing the second maneuver. I will identify the baby's back. The third maneuver is the Polling's grip. Gently grasp the lower portion of the abdomen just above symphysis pubis between the thumb and index finger and try to press the thumb and finger. The rationale of this is it determines the engagement of the presenting part and its mobility. If the presenting part moves upward, the presenting part is not engaged. If the part is firm, it is the head. If soft, then it is breech. So now, I will be performing the third maneuver. I will be identifying if your baby is engaged or not. The fourth maneuver is the pelvic grip. Facing foot part of the client, place fingers on both sides of the uterus approximately 2 inches above inguinal ligaments, pressing downward and inward in the direction of the birth canal. The rationale of this is to determine the degree of flexion of fetal head and to determine attitude or habitus of the fetus. It should be done only if the fetus is in a cephalic presentation. If there is dragging out, the fetal head is extended. When it is along the anterior side, the fetal head is flexed. At the last and the fourth maneuver, I will be performing it. Evaluate the patient's response to the procedure. Document the observation and intervention. In assessment, determine the need for Leopold's maneuver. Assess the client's overall condition. Determine when the client last voided or was last tested for urine analysis. Determine for immunization history, abnormal fetal presentation, and last menstrual period or LMP. Number 2, prepare the equipment and supplies, which is stethoscope, tape measure, and bath towel. The rationale of this is to save time and effort. Inspect the client for the following: scars, diastasis recti, hernia, linea nigra, striae gravidarum, contour of the abdomen, state of the umbilicus, and skin condition. Determine the fundal height using ulnar side of the palm. Measure the fundal height using the measuring tape. Place the zero lines of the tape measure on the superior border of symphysis pubis, and then stretch the tape across the abdomen's contour to the top of the fundus along the midline. Now I will start measuring your fundal height using this tape measure. place on your both hands to make it warm. The rationale of this is it provides comfort to the client. Place the bell side of the stethoscope chest piece on the fetus convex portion closest to the anterior uterine wall, and listen by pressing it firmly and very gently. Count a full minute holding the stethoscope chest piece while the other hand feels for the client's radial pulse. Thank you for your cooperation. Document the procedure, including the test performed. Notify the healthcare facility responsible regarding the results. Perform a detailed follow-up based on findings, and teach the client how to do proper follow-up and provide appropriate instructions. Goal: to remove normal perineal secretions and odors and to promote client comfort. Assess for the presence of irritation, excoriation, inflammation, and swelling, urinary or fecal incontinence, recent rectal or perineal injury, indwelling catheter, excessive discharge, other pain or discomfort. Determine the perineal genital practices and self-care abilities. The equipment for the special perineal genital care are solution bottle, bed pad, perineal pad, bath towel, bath blanket, and clean gloves. Determine whether the client is experiencing any discomfort in the perineal genital care. Obtain and prepare the necessary equipment and supplies. Prior to performing the procedure, introduce yourself, verify the client, explain what you are going to do, and why is it necessary.
Good day, my name is Princess Julia E. De La Paz, a student nurse from Nueva Ecija University of Science and Technology. May I know what is your name, please?
Mrs. Hansen.
May I know where are you from? Okay, so Ma'am Princess, today we will be performing the perineal genital care. Is that okay with you?
Perform hand hygiene and observe appropriate controlled procedures. Close the curtains of the bed to provide privacy. Describe client's privacy. Fold the top linen to the foot of the bed and fold the gown up to expose the genital area. Place a bath towel under the client's hips.
Tagilid po tayo. Okay. Tayo.
Position the client in the back-lying position with knees flexed and spread well apart.
Now, I will position you in a back-lying position with knees flexed.
Cover her body and legs with the bed blanket position so a corner is at her head. Apply gloves, wash and dry the upper inner thighs. Inspect the perineal care. Wash and dry the perineal genital area. Inspect perineal for intactness. Inspect particularly around the urethra in clients with indwelling catheter. Clean the buttocks. Assist the client to turn on the side facing away from you.
Now, I will put you in a side-lying position so that I can clean your buttocks. Is that okay with you?
Pay particular attention to the anal area and posterior folds of the scrotum in males. Clean the anus with toilet paper if necessary. Dry the area well. Remove and discard gloves. Perform hand hygiene. Relate the current assessment to a previous assessment. Conduct appropriate follow-up such as prescribed ointment for excoriation. Report any deviation from normal to the primary care provider. Document any unusual findings such as redness, excoriation, skin breakdown, discharge or drainage, and located in any areas or tenderness.